This lecture will be discussing smoking cessation. My name is Elizabeth Gavioli, and I am an assistant professor at the Arnold and Marie Schwartz College of Pharmacy and Health Sciences. The lecture will discuss the background of smoking cessation, including the health benefits of quitting and risk of smoking. We will also go over strategies to help motivate patients to quit smoking. Lastly, we will discuss both non-pharmacological and pharmacological treatment options for smoking cessation. Cigarette smoking is the leading cause of preventable disease within the United States. An estimated 34 million adults in America currently smoke cigarettes. Smoking is more prevalent in males, those with lower education, the disabled, and patients with psychological distress. Nicotine is the primary addictive substance within tobacco that activates the reward pathway by dopamine. However, many other neurotransmitters are also affected by nicotine, including norepinephrine, acetylcholine, glutamate, and serotonin. Patients who choose to smoke will have diminished health compared to those who don't, including cardiovascular disease, pulmonary disease, and many different types of cancers. When trying to get a patient to quit smoking, it's important to identify the advantages of quitting, such as a reduction in cardiovascular disease and lung disease. It also will save the patient a lot of money. However, they may want to know some disadvantages that will go away with time, such as withdrawal symptoms, weight gain, and a depressed mood. Both the combination of behavioral therapy and pharmacotherapy is recommended as first-line treatment and is the most effective technique to help get a patient to quit smoking. Healthcare providers will often utilize the 5 A's when interviewing a patient. Once a patient decides to quit smoking, they may lose motivation along the way. However, by reassuring the patient and reminding them why they quit, we can help them stay on track. Providers here may often utilize the 5R strategy at this time, which includes relevance, risk, rewards, roadblocks, and repetition. Let's first discuss some non-pharmacological distractions. Next, let's discuss pharmacological treatment options. Nicotine replacement therapy, or NRT, is one of our first-line treatment options, and there are many different products available. Combination therapy is often more effective than monotherapy, such as utilizing the nicotine patch with an as-needed lozenge or gum for cravings. Many of these products have key counseling points that you should be familiar with. For example, if patients choose to use the patch, they should be counseled to alternate location sites daily to avoid skin irritation. Many patients may experience a common side effect of vivid dreams. If this bothers patients, then they may take the patch off in the evening before bed, with a new patch put on in the morning. If patients choose to utilize the gum, they should be counseled on the chew and park method for best absorption. They should also be counseled to avoid food or drinks 15 minutes before or after using the lozenges or gum.